Hi, thank you for joining us again today. I'll start with the update of today's statistics. 1,429 positive cases were reported yesterday, which is 12.3% of the total number of tests, and means that the overall number of confirmed cases is now 163,762. 451 of today's cases are in Greater Glasgow and Clyde, 244 in Lanarkshire and 178 in Lothian. The remaining cases are spread across the other 11 health board areas. I can also confirm that 264,991 people have now received their first dose of vaccine. Having focused first on vaccinating care home residents, we are of course now continuing to rapidly expand the vaccination programme. Thousands of vaccinations are now taking place each day at the NHS Louisa Jordan in Glasgow, and work is ongoing to establish further major vaccination sites. And I want to take the opportunity to thank the Army for the logistical support that they are providing. Of course, all of this is in addition to the more than 1,100 locations, many of them GP surgeries, that are already being used to administer vaccinations. We remain on track to complete first dose vaccines for the JCVI priority groups 1 and 2 by the start of February. Just to remind you, that includes care home residents, which I'm pleased to say are almost complete already, health and care staff, and everybody who is aged over 80. By the middle of February, we will have completed first doses for groups 3 and 4 of the JCVI priority list. That includes everybody over the age of 70 and also those who are deemed to be clinically extremely vulnerable. And people in these groups will start to receive their appointments later in January. We aim to complete first doses for everybody over age 65 by the beginning of March, and as I have set out before, we aim to reach the whole of the JCVI priority list by early May, and then of course the rest of the adult population will follow thereafter. Of course, all of this is subject to getting the supplies we need, but we will provide regular detailed updates on progress in addition to the publication of figures on a daily basis. Now, if I can return to today's other figures, 1,959 people are currently in hospital. That is 41 more than yesterday. And as you can see, that is now significantly above the peak of hospital occupancy that we saw in the first wave back in April last year, when the numbers of people in hospital at any one time peaked at around 1,500. So that demonstrates the pressure that hospital services continue to be under. 146 people are in intensive care. That, though, is one fewer than the situation yesterday. And no additional deaths were registered in the past 24 hours of patients who first tested positive over the previous 28 days. However, again, a word of caveat around that. As you recall, the figures we report on a Monday are often low because registration offices are largely closed over the weekend. Since the last media update on Friday, we've recorded 78 new deaths in these daily figures, and that takes the total number of deaths under the daily measurement to 5,305. And that total is a reminder again of the devastating impact this virus can have. And as I always do, and it is always important for me to do so, I want to send my thoughts and condolences to everybody who has lost a loved one. Now, I'm joined today by the Chief Medical Officer, who will shortly help me take questions. Before that, though, I've got a few things that I want to briefly update on. Firstly, just to highlight that in place of the media briefing tomorrow, I'll give a statement to Parliament following the Cabinet's review of the current restrictions. At tomorrow's Cabinet meeting, we will look at all of the latest data and come to a view on where we are and whether we need to extend the lockdown restrictions to help us further suppress the virus. But I will report on that following Cabinet's discussions and decisions tomorrow. In addition, I think it's important to highlight that the new travel restrictions that were announced last week came into force this morning. These mean that anyone travelling to Scotland from outside the UK or Ireland must have a negative test result from a COVID test taken less than 72 hours before their arrival. In addition, all travellers from outside the UK and Ireland must self-isolate for 10 days unless they are travelling under one of the small number of exemptions that have been agreed for certain sectors. These new restrictions are a vital additional measure to reduce the risk of new variants of COVID coming into Scotland and the UK. 10-day isolation, of course, has been in place for some time, but the requirement for a test is a new measure. We're also considering some additional measures, such as using hotels for people from outside the UK who are required to isolate. But the most important message about travel right now remains a very simple one: don't. The best way of tackling the virus for all of us is to stay at home unless there is an essential reason to leave home, and that applies to travel. Do not travel unless you have an absolutely essential reason for doing so. Now, I have 3 other points I want to quickly cover today. The first is just to flag up the establishment of an NHS medicine delivery service. We know that some people find it difficult to visit their local pharmacy, either because of their clinical conditions or because the nearest pharmacy is some way away. And that is always true during the winter months when bad weather makes it harder for people to walk to pharmacies, especially if they, as they might be right now, are required to queue outside before being served. Many pharmacies already offer deliveries to some people, but we want to establish a more consistent and comprehensive service. So for that reason, we're investing £5 million to establish an NHS medicines delivery service, which will be available to approximately 1.5 million people across the country, including those who have been shielding and other people who pharmacists believe would benefit from the service. The service will be operational by the end of this month, and it will be available until at least the end of March, although we will keep that under review. This will reduce the need for some people to go outside for their medicines at a time, of course, when transmission rates are still high, and it will help people who struggle to get to their nearest pharmacy and ensure that everybody has ready access to the medication that they need. The second issue I want to cover relates to additional support that we're providing for carers, those who have to spend time looking after a family member, loved one or friend. Carers do an exceptional job at every time, but the pandemic has increased the pressure that many of them feel. They've had to carry out their caring responsibilities at a time when many of them, like all of us, are worried about the risk to our own health and to the health of the people that they care for. Many carers have also faced other difficulties during the pandemic, worries about their jobs and finances. And of course, the pandemic means that traditional respite breaks for carers are either heavily restricted or completely unavailable. So we're providing additional funding of £750,000 to support carers over the next few months. That funding will be mainly directed to local carer centres, and these centres will be able to give small grants to carers who can then spend that money on something that might give them a bit of a break during these difficult times. And the centres will also be able to expand much needed services such as counselling and support groups. Carers have undoubtedly played an essential part in helping us collectively to get through the pandemic so far. So I want to take the opportunity to say a very heartfelt thank you to everybody who has unpaid caring responsibilities. Today's funding is relatively small, but I hope it goes some way to providing that extra support that all of you need and deserve. I would encourage carers, if you've not already done so, to get in touch with your local carer centre to find out how this additional funding might be able to help you. Now, the final item I want to update on today is additional funding for taxi drivers. The pandemic has been difficult for taxi drivers and their families, just as it has been for people across a range of different businesses. Despite that, taxi drivers have continued to provide a vital service for key workers and vulnerable individuals, and I want to thank all of them for that. The Scottish Government has allocated a total of £57 million to help the 38,000 private hire and taxi drivers who are registered in Scotland. Local authorities will be directly approaching these drivers to invite them to claim a grant of £1,500. That, of course, is in addition to the other business support which is available through both the Scottish and UK governments, and it's intended to help taxi drivers meet their fixed costs at a time when they're receiving very little income. Local authorities will be starting this week to get in touch with taxi drivers and get that money to them as quickly as possible. Before I finish today, I just want to give a quick reminder again of the key rules and guidelines that we're asking everybody right now to follow. Of course, the main rule for everyone right now is a difficult one to abide by, but a simple one for me to articulate, and that is stay at home. You should only be leaving home right now for essential purposes, caring responsibilities, essential shopping, exercise, work that genuinely cannot be done from home. If you meet up with someone outdoors, you should only be meeting with one other person from one other household. And of course, work from home if you possibly can. And on any occasion when you are required to leave home, please remember facts. Face coverings, avoid places that are busy, clean your hands and surfaces, use 2 metre distancing if you are talking to somebody from another household, and self-isolate and get a test if you have symptoms. Fundamentally, though, the best way of keeping ourselves safe right now, while transmission rates remain as high as they are, is to stay at home as much as possible. And as I did last week, if I can appeal to everybody to stick to the spirit of these rules as well as the letter. We shouldn't be thinking about how much we're able to do right now within the rules. Instead, we should all think about how far we can reduce the numbers of times we have to go out and the numbers of other people that we're interacting with. All of that helps to deprive this virus of opportunities to spread. That means that we will get case numbers down, we'll get test positivity down, and in time we will start to see a reduction in the numbers of people needing hospital, intensive care, and sadly dying as well. And what it means is that as the vaccination programme continues to gather pace, we'll be slowing the virus down and given the vaccination programme every possible chance of ultimately winning this race that we're in between the virus and the vaccine. So thank you, everybody, for everything you're doing to help us with that. But I'll leave you with that central, all-important message right now. Stay at home, protect the NHS and save lives. Thank you very much for listening. I'm going to move now straight to questions, and the Chief Medical Officer will help me answer these. Firstly today is Laura Goodwin from the BBC.
Good afternoon. People aged 70 and the extremely clinically vulnerable in England, in parts of England, have started to receive their vaccines. Can you explain why this is happening at a different time in Scotland, and where supply and capacity allow, is this something you'd be looking to speed up? And for the Chief Medical Officer, given that many clinically vulnerable people would be looking to get their vaccine at the GP surgery, and we're hearing for some that supply has been patchy, why has it been patchy? And do you concur with the UK government's view that it is beginning to improve?
I'll hand over to Chief Medical Officer in a second. I indicated in my opening remarks that people in the over 70 category and the clinically extremely vulnerable will start to get letters for appointments later in January. Now, that, given the stage in January we're at right now, literally means over the coming days. So that will be very soon that next part of the programme gets underway. I think it's important to stress that, as far as I'm aware, all nations in the UK are working to the same targets in terms of when we aim to have vaccinated at least with the first dose, the different JCVI priority groups. So the groups 1 to 4, by mid-February, we will do the over 80s, including care home residents and NHS and care staff by the very beginning of February. So we're all working to those targets. We're on track to meet those targets, supplies permitting and allowing, of course. The reason why there's a slightly different pace at the moment is because we started in Scotland, as the JCVI recommended we did, in care homes, and taking the Pfizer vaccine into care homes, vaccinating elderly care home residents is a bit more labour intensive and time consuming, but we have focused on that first. So we are now, I think about 80%, perhaps more than that now, through the vaccination of care home residents. I heard the UK Vaccines Minister on the television this morning saying that about 50% through care homes. So we've started slightly differently, but we are all working to the same targets. And now that we have more or less completed or are in the very final stages of completing care home residents, we increasingly will see the pace of the vaccination in the community group, starting, of course, as we did last week with over 80s pick up pace. And we'll continue to give regular updates on this, as well as publish the daily figure that we started to publish a week or so ago.
So I think there's two parts to your question, Laura. I'll try and answer them in turn. The first part is about the prioritisation that JCVI have advised us to undertake when we're looking at the broader vaccination programme. There's a lovely study which was published just in the last week, which looks at some of the data and justification as to why that order has been particularly emphasised by the JCVI. And when you start to break that down, what you see is that the number needed to vaccinate in order to save a life in a care home is as low as 20 people, whereas when you start to get into those over 70s groups and the clinically extremely vulnerable, it's 600. So you can see the orders of magnitude of a difference there in terms of why spending the priority time at the beginning to try to protect those who are most vulnerable is time well spent, in my opinion. And that's why we've emphasised the need to make sure we've covered as many of the care homes as possible before moving on through these other groups just now. In terms of what you've referred to as a patchy supply across Scotland, just earlier on this morning, I had further discussion with the Chief Pharmaceutical Officer, and we spoke about the supplies of the Oxford AstraZeneca vaccine that are coming into Scotland and how that's then put forward to the GP practices. And really, it's going out to those GP practices as quickly as it's coming into Scotland. What we expect is over the next couple of weeks towards the end of January, as those supplies coming in to Scotland begin to increase, the actual supplies and the way the throughput goes to the GP practices will increase as well. But it really is about pipeline into Scotland just now, which is the rate limiting step.
Peter McMahon from ITV Border.
Thank you very much, First Minister. Do you not feel that there's a bit of a problem if senior GPs are describing the process of getting approval to give vaccinations as bureaucratic? And to follow up from my colleague's point, also that the supply is patchy. And could I also ask the Chief Medical Officer if he has an update on the outbreak in Stranraer, which, as we know, was particularly serious, a large number of cases there. Are things improving there?
Well, as well as asking the Chief Medical Officer to comment on the second part of that question, he will want to comment, no doubt, on the views of GPs, being a GP himself. It is in nobody's interest to make this bureaucratic, and we will look to simplify as we need to, as we go along this whole process. We want to get this done absolutely as quickly as we possibly can. One of the issues that we are not entirely in control of, obviously when supplies are allocated to Scotland and come into Scotland, our job is to get them to vaccination centres and into the arms of people as quickly as possible. But we're not entirely in control on the flow of supplies coming into the country. We did, of course, seek to put some more information on our expectations around that into the public domain last week, but we agreed with the UK government to take that away again because there were concerns about commercial confidentiality. So, but we are keen to be as transparent around this as possible. But we are dependent on the flow of supplies coming in. The supplies, with the Health Secretary, had a very good, very constructive conversation with senior management in AstraZeneca just last week, and the supplies, just by dint of the manufacturing process, are a bit bumpy at the moment. They would expect them to level out and become much more sustainable at a certain level as we go further into this year, but at this early stage they are a little bit bumpy, and that is reflected, of course, in the supplies that are coming into Scotland. But as we get supplies, our job is to get them to people and to get people vaccinated as quickly as possible.
Public Health Scotland and NHS Education Scotland have been working very closely together around about the training packages that are necessary for vaccinators in order that they can provide the vaccinations by each of the two different vaccines that are available to us just now. And where people have previous experience of providing vaccinations, it's a fairly straightforward process to be able to update that with training specifically in relation to some of the considerations with these two vaccines. And that's been given to almost 5,000 people across Scotland now over a series of webinars for staff during the first part of December and then again at the beginning of January. Where it becomes a little bit more complex is making sure that we've ensured all the adequate training for those who've got no previous experience of vaccinations. And again, that programme has been developed by Public Health Scotland and NHS Education Scotland, just to make sure that it entails everything that we would expect people to be aware of when they're giving these vaccines. We constantly keep it under review, and we make sure that we update that according to some of the feedback that we get from people who are going through the programme. But what it is it's a comprehensive programme that ensures the safety and also, very importantly, the effectiveness of this programme to make sure that everything's delivered in the right way. On the second point about Stranraer, generally across Dumfries and Galloway, what we're starting to see now is a slow reduction in the case rate there. You'll recall that in particular, Dumfries and Galloway experienced a very rapid rise, which we strongly associate with large proportion of the new variant virus. But like some other areas of Scotland just now, we're now starting to see that give a slow decline. Too early yet to be confident that it's going to continue that way. We need to make sure that we're all continuing to follow the guidance, make sure we're taking all steps to limit the opportunities for this virus to spread further. But certainly some encouraging signs just now that the kind of community outbreaks that you're speaking of, both in Stranraer and in other parts of Dumfries and Galloway just now, are beginning to slow down the transmission as well.
Ross Govins from STV.
Afternoon, First Minister. You mentioned in your opening remarks there you will be speaking to the Cabinet tomorrow about possible further restrictions. Just wondered if you give us a flavour of what you may be considering, and specifically to the Chief Medical Officer. We now have 39 cases on the island of Barra. I believe that's around a tenth of the population is now having to isolate. What more can you tell us about the situation there?
Just to be clear, what I spoke about, although Cabinet will consider the data and if there are other options we need to consider, we will. But what we will be looking at tomorrow is not additional restrictions over and above the current lockdown restrictions, as much as whether the current lockdown restrictions need to be extended for a further period beyond the end of January. Because obviously we want, as far as we can, to give people a degree of notice about that. So it is the duration rather than the content of restrictions that we will be looking at tomorrow. And I'm not going to preempt that discussion. I will, though, after that discussion, set out any conclusions we reach in a statement to Parliament later on tomorrow. Barra, I think, will be, and the Western Isles will be one of the issues that we are discussing with the Chief Medical Officer, and I have briefly been discussing that already this morning, but I'll hand over to him to say a little bit more.
What we're seeing in Barra just now is a good example of what happens when perhaps people let the guard down and come together. And this virus takes every opportunity it can to spread between people. We've been monitoring it very closely since the end of last week, when the rise in case numbers began to become apparent. And the IMT met locally over the weekend, and the National IMT has met this morning discussing some of the specifics of this particular outbreak just now, so that we can monitor it and respond to it in the best way. First Minister and I have had some preliminary discussion about it. We'll continue that discussion with ministers and with officials over the course of the day, and then we will decide as to how we want to take that forward to try to limit and contain any further spread within those communities.
Alan Smith from Bauer.
Thank you, First Minister. You mentioned in your opening remarks about the Army now being involved in setting up these vaccination centres in Scotland. One of their main tasks is identifying suitable sites for the programme. Is there any reason why they weren't involved from the very start of the programme, and at what point it was decided it was necessary that they were needed to be brought in to help with the vaccine programme in Scotland? And just secondly, if I may, what's the current thinking surrounding construction? Because around 10 days ago, I know it was something that was being looked at alongside other services which have seen tighter restrictions. The Unite Union says there's disbelief that non-essential construction is continuing, with hundreds of workers continuing to travel across Scotland. So is it likely the construction sector could still see some further measures introduced? Thank you.
In terms of the Army have been involved periodically to a greater or lesser extent, depending on the stage we're at, in our pandemic response from the very early stages. In fact, for quite a lengthy period last year, we had military people based in this building giving us logistical advice. So they've, over the course, been involved in the logistics around our PPE supply chain. They were involved at an earlier stage in the logistical planning for the NHS Louisa Jordan, and they have had input into our discussions around vaccine delivery. So this is not some sudden we're involving the army. This has been an ongoing, and we will request their help and support where we think they have got some logistical expertise and resource to offer us, and that is the case. We have always said that as the supplies of the vaccine increase, so too will the number of mass vaccination centres. We have, and everybody will have seen pictures on social media over the weekend of the NHS Louisa Jordan being used as a mass vaccination centre. Right now, the supplies of the vaccine don't enable us to do large numbers of mass vaccination centres, but that will change in the weeks to come. So this is the appropriate moment when we make the final decisions around the establishment of a number of other big centres. But right now, with the supplies we've got, with the population groups we are focusing on at this early stage, the more than 1,100 sites across the country, which are in the main part GP surgeries, but also smaller based community vaccination centres are already up and running and operational. And your second point was construction. Look, we don't ever say, we've discussed this and we'll never discuss or consider it again. We came to a judgment last week that with all of the very stringent mitigations that construction are obliged to follow, the balance of judgment was not to bring a stop to non-essential construction. Remember, non-essential construction will be things like house building. There is a need, if we can possibly do it, to continue to do these things because people need houses and places to live, just as an example. But the safety of people in construction is paramount and cannot be compromised. So if we think at any stage that the levels of transmission, that the risks we're seeing in construction mean that that can no longer continue, then of course we will take that decision. So these are, whether it's this one or any other decision, they are ongoing. We continue to review and consider trying to reach the best balance of judgment and the best balance of risks that we possibly can. Neil Pooran from PA.
Thanks, First Minister. Do we have figures for how many care home staff are refusing to take the coronavirus vaccine? We've heard that the figure for some care home groups in the UK might be as high as 20% for people who are saying no. And as well as the figures, do we have a percentage of how many of the care home workforce has been vaccinated versus care home residents?
The number, I don't have the specific figure in front of me just now. I haven't brought it down with me. I'll get it to you later on. And of course, the figure will be updated later this week. The percentage of care home staff that have been vaccinated is lower than care home residents, but it is increasing. And overall, in terms of NHS and social care staff, we are over 50% of staff being vaccinated. I don't have a number, and I'm not sure, it's not just that I don't have it here, I'm not sure we have a number, but I will check for those who are actively refusing to be vaccinated. I would hope that that is a small number. I have read and heard reports of, sort of anti-vax forces trying to target staff in particular groups to discourage them from taking the vaccine. I would really deprecate that kind of conduct, but we are thinking very hard about how we make sure, and Gregor will want to say a word about this through webinars, outreach, and we're working with Scottish Care, particularly in the care home sector, to make sure that any concerns that staff have are being properly addressed and responded to. It's in everybody's interest. If you're offered this vaccine, whoever you are, whatever sector you work in, whatever age you are, when you're offered this vaccine, my strong plea, advice, encouragement, exhortation, call it what you want, is to get the vaccine. It is for your own good, and of course it helps us collectively fight this virus. I am very keen to get to the point, and it will be, giving away my age here, I will be in the first JCVI, the priority list that JCVI have published, although at the tail end of that. But as soon as I get the opportunity to get this vaccine, I'll be there with my sleeve rolled up getting it, and I would encourage everybody to do likewise. Do you want to say a bit more about social care staff?
Yeah, I'm going to say something just generally about misinformation within the system just now, because I think one of the biggest dangers that we face actually is misinformation in relation to vaccination. And when I hear about particularly targeted misinformation to any particular groups, it makes me really concerned, because it preys on people's anxiety and fear. My plea to everyone is to read trusted sources of information in relation to the vaccination. Myself, the Chief Nursing Officer and the Chief Pharmaceutical Officer will be writing out to all care home staff to explain exactly the rationale behind vaccination, what it can offer in terms of protection, and the safety elements in relation to this vaccination are really strongly proven in terms of the trial, the research that it's gone through just now. So I myself will have no hesitation in taking this vaccine when it becomes my turn to do so. I would encourage everyone to do the same. But just as importantly, I would encourage everyone, please, to make sure that when you are reading up, when you're trying to learn more about the vaccination, that you're going to those trusted sources of information rather than some of the things which I've seen being distributed, particularly on social media.
So just before I move on to the next question, just I have located the figure for staff in older adult care homes, which it's now over 50% of staff in older adult care homes have had the first dose of the vaccine, and it's now over 80% of residents in care homes have had the vaccine as well. Chris Musson from The Sun.
Afternoon, First Minister and Simo. You'll be aware that some health professionals have been speaking out about wastage of vaccine in recent days, and some health boards we hear have given out excess vaccines as second doses to NHS staff, for example, while others have refused to do this and disposed of them instead. So just a simple question here, why don't you tell health boards to give spare doses to NHS staff if the only alternative is to dispose of them? And related to this, on Friday, you may have heard Arlene Foster said that nearly 3/4 of care homes in Northern Ireland had seen second doses administered. This seems to go against this UK-wide directive for a 12-week gap. So just on that, because some people have been discussing this about Scotland, are you definitely going to stick to the 12-week gap, or might you consider second doses sooner in care homes if supply allows?
The 12-week, Gregor will want to say more about this. Forgive me, I didn't hear Arlene Foster on Friday, so I don't want to comment directly on that, and I don't think it would be necessarily appropriate for me to do so. We're following our own deployment plan here, which of course we published last week. But we will do all of this as quickly as supplies allow. The advice that has come from the JCVI, the MHRA, and of course endorsed by the 4 Chief Medical Officers is that we should prioritise with the supplies that we have and expect over the next few weeks in getting a first dose to as many people as possible, and that's what we're going to do. On the wastage, again, Gregor will want to comment on this from a clinical perspective, but we made an assumption in the deployment plan we published last week of a 5% wastage, and that is simply a planning assumption to take account of things like big freezers failing or other things going significantly wrong. The actual experience of wastage is much lower than that. I think it is around 1% is the experience to date. There has been, and I don't know whether this is what you're referring to, the suggestion that there is an extra dose in some of the vials, and I think the advice is that where there is a genuine extra dose that can be used. What people shouldn't do is take some out of one vial and some out of another to make up a dose, but these are to some extent, to a large extent, clinical issues in terms of what the frontline vaccinators will be doing. So I'll ask Gregor to say a little bit more.
Thanks, Chris. I guess international kind of standards and guidance kind of estimates for planning purposes around about 5% wastage in any vaccination campaign. We're trying to limit it as much as possible, and as the First Minister has already said, it's running at just above 1% just now, which is pretty good by international standards, but we want to even minimise that further. I would certainly favour people taking a pragmatic local approach. If there are going to be the potential for wasted doses, is to use common sense to make sure that they're not being wasted, and that any means are being taken to make sure that people who would be eligible for that vaccine are getting it in a timely way. Now, as I say, I think that local flexibility is important. We don't want to see any wasted vaccine if it's possible at all. Some of it is inevitable, unfortunately, just by chance through the system due to, it could be anything from a freezer failure or a dropped vial or whatever. So inevitably there will always be some wastage, but we want to minimise that as much as possible.
On the 12-week.
Yeah, on the 12-week phase, I mean, one of the things we're keeping a close eye on just now in relation to particularly care homes is sequencing the second round of vaccines, just to make sure that we don't compromise that because of considerations such as perhaps an outbreak developing within a care home that might slow down the vaccination there just now. So we're keeping that whole process under review just now, just to make sure that, again, we stay fairly flexible in terms of a forward approach and how we sequence that Pfizer vaccine as it's deployed across the system just now. And if there is the opportunity to be able to vaccinate patients at an earlier stage and ensure that we don't delay any second vaccination because, for instance, there might be an outbreak in a home that would delay it, then as I say, my preferred option would be to make sure that we take that opportunity.
Tom Martin from the Daily Express.
Hi, thank you, First Minister. Could I just pick up on some of the earlier points that were being discussed around progress in rollout? You touched in an earlier answer about saying the flow of supplies hadn't really helped in developing mass vaccination centres. I just wondered if you could elaborate a little bit more on that, because obviously we've now seen 17 opened in England. We've still really only got the one. I just wondered, people will be looking and thinking, why can they get race ahead? We're having 17 open. We've only got the NHS Louisa Jordan at the moment. And as well, can I just clarify in terms of the army involvement, how many of the 80 centres they're helping with, how many of those do you think are going to be max vaccine hubs?
These are intended to be vaccination centres, so, mass vaccination hubs. I don't think it is a case of some areas racing ahead. We're all working to the same targets that I've said before. We started in care homes and are much further through care homes. Just the nature, and remember, Scotland's geography is different as well. We've got a much more of a rural, remote population, and the population groups that we are focusing on in the early stages, not exclusively, but to a greater extent, lend themselves more to be done through the more local GP-based approach than perhaps mass vaccination centres. So this is not an either or, it's not a one approach over the other. It's about bringing on stream the different parts of this, as not just the supply, but as we get into population groups that are perhaps more able to go to a mass vaccination centre that is a little bit further distant from their home than somebody who's over 80, who would probably prefer it to be in their GP surgery or in a local community-based centre. So we will work through this logically, as sensibly as possible, and most importantly of all, as quickly as possible. Will things, not go according to plan? Will there be bumps along this road? Almost certainly. This is the biggest peacetime logistical, exercise of its kind that we have ever undertaken. But there is an absolute focus on getting this vaccination programme done just as quickly as possible, protecting the most vulnerable first, and then working through the entirety of the adult population. Conor Matchett from the Scotsman.
Thank you, First Minister. Just a couple of questions on restrictions and etc. I think tomorrow is the day you're due to review schools and potentially reopening. I'm wondering, potentially assuming that the decision is going to be that schools will remain shut to most students for most of February. And for the CMO on the same level, do you think it's safe yet for schools to open? And also just picking up on something that Michael Matheson said this morning on the radio about potential quarantine hotels. Wondering if you, Dr. Smith, would be able to give us the scientific basis for why those might be used and why we maybe haven't been using them already.
I'll hand over to Gregor, who can answer both of those questions. Look, I'm not going to preempt a decision that we will take tomorrow. You're absolutely right that we will consider the position on schools, as we said we would. Schools are closed to the majority of pupils, although schools are open for key worker and vulnerable children, but schools are closed to the majority of pupils right now to the 1st of February. We said we would review that mid-January, which is now, and I will set out the conclusion on that. We're trying... I'm not going to raise parents' expectations. You can see from the numbers that we are seeing some positive signs in the numbers, that lockdown is starting to stabilise things and hopefully start to tip them into decline. But transmission is still higher than we would want it to be, and therefore I'm not going to raise anybody's expectations about schools being back on the 1st of February, but nor am I going to stand here and make assumptions about a decision that we won't actually take until tomorrow. in fairness to teachers, parents and young people, as soon as we've taken any decision tomorrow, I will set that out to Parliament, and I think that's the best and fairest way of proceeding. What I would say is, you know, we want to get schools back as quickly as we possibly can. It is not in the interests of kids to be out of school for any longer than is absolutely necessary, but community transmission has always been a key factor in these decisions. Gregor.
One of the big considerations when you look at the international picture just now is the rise of variants of concern in different parts of the globe. We've seen, first of all, a variant first being identified here within the southeast of England, a further one being identified in the southern part of Africa, and now 2 different variants in Latin America, which all have caused some degree of concern, usually because of the heightened increased transmissibility that's associated with these viruses. So in response to that, I think it's important that we do review our approach to how we deal with the subject of international travel, and how we make sure that we learn from our experience over the course of 2020 to make sure that we are not allowing these new variants to be imported into the country. One of the ways that we can do that is to look to see how we can strengthen the arrangements around about quarantine to support people through that period, to make sure that they are not, if they do become positive after entering the country, is that they're not then spreading that on to other people. So at this stage, this is about looking at all potential options which may be available to us to try to strengthen those arrangements and to put them in place when it's appropriate to do so.
Alistair Grant from the Herald.
Hi there, thanks very much. Just wanted to touch again on the claims of the bureaucratic hold-ups and the claims that this is leading some would-be vaccinators to quit. I think someone touched earlier on in the comments by David McCall, the chair of the British Dental Association's Scottish Dental Practice Committee, who said that the current situation is a fiasco, and that dentists in England are now being allowed to self-certify to speed up the process. I think you said earlier on that the process, you look to simplify it where you can. Will it be simplified for those with clinical experience specifically? And if I could just double check as well, I think in response to these stories over the weekend, the Scottish Government said that just under 5,500 individual vaccinators have now been registered, not including all participating GPs. Is there a figure for how many of those individuals have completed the training?
I will need to get back to you on the specific figure. I want to say about 3,000, but I'm not absolutely sure that's up to date, so I'll come back to you on that. I'm not sure I've got anything else to add on the bureaucratic part of the question. It's nobody's interest to make this bureaucratic, but it's in everybody's interest to make sure that those who are vaccinating people are properly trained and doing so safely. We have sufficient numbers of people coming through that process, although we're not complacent about that, and the deployment plan that we published last week went into more detail about the numbers that we need to get to that target that we set for later in February of being able to vaccinate in the region of 400,000 people every week. But I don't think I've got anything to add to my earlier answer on that.
Yeah, I mean, there are characteristics of these particular vaccines that makes it really important that we're making sure that even those who have experience of providing clinical care in the past are getting an update to make sure that they're fully aware of all the different considerations in relation to these vaccines. We'll make sure that at all times the training packages around about this are as accessible as possible and as streamlined as possible. But really, there is a minimum which has been set by Public Health Scotland and National Education Scotland about what they feel is the correct and appropriate level of training for people who are deployed in this. And as the national organisations in public health and in education for clinical staff, I think we have to trust and accept that they're in a fairly good position to be able to judge that.
Okay, I was just seeing if I could locate the figure that you were looking for there, but I'll come back to you on that. Just to remind people, though, that what we are working towards is the recruitment and deployment plans so that we have around 1,300 vaccinators and 750 support staff by the end of January. So that is to support the overall targets in terms of the numbers of vaccinations we want to do on a weekly basis and the targets in terms of groups completed that I set out earlier on. Paul Mallock from the Courier.
Good afternoon. I was wondering if you would be able to say if there's plans to use the percentage of the population who have been vaccinated as a measure of easing lockdown restrictions as we move forward. And with that in mind, has it always been the intention to bring in the Army to identify and ready vaccination sites? And if not, when was this decision made? And First Minister, were you involved in the decision?
I tend to be involved to a greater or lesser extent in all of these decisions, but clearly decisions are taken at different levels. But I take responsibility for everything, whether I always like it or not. I answered the question about the Army. The Army have been involved at different points in our pandemic response all along. This is not a case of suddenly deciding to involve the Army. I think I said in response to a previous question, the Army were based in this building for quite a significant period of time last year, being part of different things. So we call on them when we think they have the expertise to help us with particular tasks, and we're very grateful to them for that. In terms of your question about easing lockdown, I mean, clearly the speed and the pace of the vaccination programme is important as we try to get back to greater normality. I think it is perhaps a bit too simplistic to say it's only that. One of the things, and people will have heard us say this before, that is not yet known about this vaccine is the extent to which it stops people getting and transmitting the virus. We do believe that it stops people becoming very seriously ill, but there's no doubt the more we get people vaccinated, then the greater the chance of us restoring some normality to life, although the virus will not suddenly magically have disappeared. Simon Johnson from the Daily Telegraph.
Thank you, First Minister. I just wanted to pick over some of the vaccination figures. The total you announced for the people that have been vaccinated so far at the start of this briefing was around 40,000 higher than the total we received on Friday, 3 days ago. So that works out at just under 14,000 people per day. We were doing 16,000 people per day at the end of last week. So has the rollout slowed down a bit at the weekend? I also wanted to ask, the last comparable day we've got figures for England and Scotland was Friday, when we've got around 16,000 people vaccinated in Scotland, 320,000 in England, which is about twice as fast, taking into account the relative populations. Does the greater emphasis on care homes really explain such a large difference? And lastly, Dr. Andrew Bewis was on the television yesterday at the BMA saying that he's not in a position at the moment to send letters to his patients over 80 because of the patchy supply. If that's correct, then how could it be that patients over 70 are going to be getting letters shortly? Thanks.
I think we've probably covered most of these points already, so I don't want to just stand here and repeat everything, although people probably can accuse me of doing that quite regularly. This will be, different areas, different practices will start sending out letters for over 70s, while others are still doing over 80s. We don't wait until, and shouldn't wait until one group is completely completed before starting on another. Indeed, having heard the UK's vaccine minister on the television this morning, it is not the case that in all parts of England, over 70s are starting to get letters. It's only in some areas. So we're all working through this in as sensible a way as we possibly can. I'd need to do your maths in terms of the daily rate, or do my own maths in terms of the daily rate. We are picking up we've set the target in terms of weekly vaccinations that we want to be carrying out. Obviously, it builds up to that, and inevitably in any big programme, you will get daily variations in that, but the trajectory overall should be and will be an upward one. And this should even out, but the fact that we started in care homes has had an impact on the relative numbers for the reasons I've already set out. But that, as we complete care homes and go into, we are already in wider community vaccination in the over 80s groups, then these things should even out as we go along, because we're all working, broadly speaking, to the same overall targets.
Vaccination centres as well. You mentioned demography before. I think when I asked about it last week as well. But some of the places that have got mass vaccination centres today in England are relatively small places, such as Blackburn, St Helens, Taunton, much smaller urban areas than, say, Edinburgh or Glasgow. So why is it that these places, relatively small places, are getting mass vaccination centres in England?
Look, I can't comment on the decisions that have been taken in England. I know the geography of some of England. I'm not an expert on the geography of England. My responsibility as head of the Scottish Government is to make sure we roll out this vaccination programme properly, quickly, efficiently in Scotland, and that's what I'm focused on. So I'm focused on making sure we are taking the decisions in a proper way in Scotland. Undoubtedly, there will be differences in the how of what we are doing between Scotland and England, and that will be accounted for by a range of things. Geography will be one of them. In the early stages, the greater focus we put on care homes will be another one of them. But at the end of the day, it's the targets we are setting. We're all working broadly to the same targets. How we choose to get there might be differences in. And I can't give you a running commentary on the decisions that health authorities in England are taking there, nor should I try. My focus is on making sure we're doing it right for the Scottish circumstances and be accountable for that, as I will continue to be on a daily or almost daily basis standing here. Rachel Watson from the Daily Mail.
Thank you, First Minister. The UK government have said they aim to vaccinate all adults with their first dose by September. Is that a target that Scotland can meet, and could it be done sooner than that?
Yeah, we would broadly be of the same aspiration there. Is it a target we can meet? Can we be done sooner than that? That will depend on the supplies that we get. So, you know, and that is true of the UK government as well. Now, obviously, we put out some indications of supply expectation last week and have removed them from the public domain again for reasons of concern. So we think that if all the supplies that we're expecting come through, then I would be hopeful that we will be in the position of doing the whole adult population in that kind of timeline. But the caveat here is always going to be supply dependent, as well, of course, as we get the supply, making sure that we've got the deployment plans in place. Chris McCall from the Daily Record.
Thank you, First Minister. SNP MP Kenny McCaskill has told the Daily Record that he thinks the Holyrood election plan for May can go ahead despite the ongoing pandemic. But he's also said that he thinks it's possible that a second independence referendum could take place this year as well, and that politicians will just have to adapt their campaigning to the current lockdown. So are we realistically facing both an election and a referendum being held this year?
Look, this is a COVID briefing and I'm going to stick to the discipline as far as I can of keeping it on that. I've commented before, I think the election, as things stand just now, can go ahead, but I've also said that's not just a question for me, that is a decision. If there was any change in that, would have to be taken on a cross-party basis, and we have contingency plans in place to change the way in which the election proceeds, should that be considered necessary, and the presiding officer of the Parliament has a role to play in that. Beyond that, into independent stuff, this is not the time or place to talk about that.
We will see more of an online campaign likely in May.
Think,
before the election campaign does happen then.
Chris, we're all living our lives much more online, so I think it stands to reason that all aspects of life right now are more online than they are normally, and I can't stand here and tell you how all parties are going to be campaigning for the election come, you know, March or April, but I think it's a fair assumption that we will see more online campaigning than perhaps we have done in previous elections. But that's for everybody standing for election to work out within the rules that will be in place at any particular stage. Mark McLaughlin from The Times.
Good afternoon, First Minister. You may have seen at the weekend the Office for Statistics Regulation took issue with your care home report, which concluded there was no evidence or little evidence of hospital to care home transmission. They said that you, Public Health Scotland, overstated the confidence intervals, and there was actually a causal relationship between that. And also they took issue with the fact you highlighted all of these things in bold, showing no causal relationship. What's your response to that? Did you over-egg this report, or did your officials over-egg this report?
No, to both. I think when the report was published, I stood here and quoted from the report. I think it's probably for Public Health Scotland. I think they've replied to the Office of National Statistics, Office for Statistics Regulation, a different organisation. And as far as I have read, that report was, I think, overwhelmingly positive about the Public Health Scotland report and the methodology used, but I'm not going to go into any greater detail about that because some of these issues are highly technical in terms of statistical, the use of statistics and also confidence intervals. But, you know, just reading from the OSR comments, I think it said the confidence intervals again suggest these findings are not significant. So I don't think there was anything that was suggesting that the overall finding of the PHS report was in any way invalid. But given the technical nature of it, I'm sure PHS would be more than happy to give further comment, unless you want to.
I think you covered it exactly. It's about ensuring that we take the statement in its entirety rather than cherry picking bits from it.
Okay, that concludes the questions for today. My thanks to all the journalists, thanks to Jill for our BSL interpretation, and to Gregor, Chief Medical Officer, for helping me with the questions. As indicated earlier on, I will make a statement to the Scottish Parliament tomorrow, setting out the conclusions of the Cabinet's deliberations tomorrow, and I'll make sure we put on social media the precise timing of that when Parliament has confirmed it. And I'll then be back here on, no, I won't be back here on Wednesday, my apologies. I'll be back in Parliament on Wednesday for the weekly session of First Minister's Question, and see you from here later in the week. In the meantime, I think I'd summarise the position overall as still very precarious, still very concerning in terms of the levels of transmission, but some early signs to be optimistic that these very difficult restrictions we're all living with and under are having an effect and starting to level off case numbers, and hopefully we'll see them decline in the period ahead. So please stick with it, and most of all, for now, stay at home unless it is essential to be out of your home, because that protects the NHS and ultimately, of course, it saves lives. So thank you all very much, and I'll see you from Parliament tomorrow.